Thank you everybody for joining me this beautiful morning for our monthly installment of the Orthopedic Minute. My name is Bob Keel. I'm a physician assistant that works at the Memorial Hospital of Carbon County. I mainly do orthopedic issues, which are bone and joints. Today we're going to talk about shoulder pain. A lot of shoulder pain is very common in both young and adult populations, and it can be very debilitating. It can limit daily activity, or it can make you not want to do daily activity because of the pain. And so today I'd like to talk about a couple common causes of pain in the shoulder and how we can treat those and get you feeling better. First of all, I'd like to start with the fact that the shoulder is a very complex joint. It involves the shoulder blade, which we call the scapula, the humerus, which is the arm bone, and the collarbone or the clavicle. The scapula or the shoulder blade is a very complex bone that creates both the roof of the joint as well as the cup for the ball and cup portion of the joint, as well as a couple other structures that we'll discuss at another time. And so there's a lot of moving parts. There's a lot of soft tissues like tendons and ligaments and nerves that are involved in the shoulder. Most commonly, people deal with pain in the shoulder due to some sort of injury, oftentimes a work injury where you fell and tried to catch yourself, or you were lifting something very heavy and felt something pop in the shoulder. A really common term that I think everybody can relate with is the rotator cuff. The rotator cuff is actually a small group of muscles made up of 4 different muscles that help with specific movements in the shoulder. Interestingly enough, if every one of those muscles were to, and so a lot of times we'll get somebody that has fallen at work or done something at work and their shoulder hurts. It hurts up here and it comes down the arm. They can't sleep at night. They can't lay on their side like they normally would. It hurts to move their arm and do stuff. And in severe cases, people can't lift their arm above their head. They'll come in and they'll do something like this where they just can't move the arm. They can move the elbow okay, but they can't move the arm. And that is typically what we see with somebody that's got a torn rotator cuff. A torn rotator cuff doesn't get better on its own. Typically, if it's a complete tear of those 4 rotator cuff tendons, it needs to be repaired. And unfortunately, it's a very long recovery. We usually, so let's talk about if you didn't have an injury and your shoulder hurts. A lot of people, they'll come in and they'll tell me that when working out in front of them or working up above their head or across their body, they just get this profound ache in their shoulder. And then it's very uncomfortable, and they really avoid doing things at work or at home because it hurts. These people typically, if you push around on their shoulder, where the clavicle and the shoulder blade meet is a joint. It's called the AC joint. I like to refer to it as the roof of the shoulder. And that joint creates stability for the shoulder. And when you have arthritis in that joint, anytime you move your arm up or away from your body or across your body, it can really aggravate that joint, and that joint can really hurt. And unfortunately, when you get arthritis in that joint, it can grow down into the space where the shoulder works. And so when you work up above you, you're grinding those bones together, and it just hurts quite significantly. AC joint arthritis is treatable. It can be treated with physical therapy. It can be treated with a steroid injection. And typically, in severe cases where function is limited, we can go in and shave off the bone spurs and open up that joint and allow you to have function back. Shoulder pain isn't fun. It isn't easy to deal with, but I will always tell my patients it's always a good idea to go and try and do something to help improve it, because it can be so debilitating for you and your daily activities. And so if you have any of these issues, please come talk to us here at the Memorial Hospital of Carbon County Orthopedic Clinic. It's something we deal a lot with. It's something that I feel confident that is very treatable and something that we can help you out with. I'd like like to thank you for coming and participating in the Orthopedic Minute.